Thanks. Sure. Let me just open a new conversation. Um, and Joe, you think you can take care of the IFT case, right?
Yeah, I can do that.
All right. Awesome. Thank you.
All right. So I have a 70-year-old female who fell and hit her head on the ground. She was transported to community hospital and was intubated due to AMS
Can you slow down a
and
little bit?
unable to protect. Yeah,
Yeah. So,
sorry.
yeah. So I have a 7-year-old
Uh,
who fell. Uh huh.
and hit her head on the ground.
Uh huh.
She was transported
Uh huh.
to a community hospital and was intubated. Due to AMS and unable to protect her airway.
Okay.
The hospital is requesting that she be transported to City Hospital to the ED care.
Uh huh.
CT shows a subdural bleed
Uh huh.
with midline shift of 1 centimeter. Her current vitals are a BP of 160 over 109. Her heart rate is 106. Her SpO2 is 92%. And she has a PMH of using blood thinners. And she's on a vent with the mode of AC. And I have the vent settings whenever you're ready to copy them.
And you say, and she is on event mode assist control, right?
Yep, assist control.
The nice thing about an IFT scenario is that being IFT, you naturally have many more details to work with up front.
Exactly. And you also have that moment of time where, like with your scenario, you've got a kid in front of you that's not doing well. You got your hands full, and, you might have to take a second once you get into the truck to pump something into the AI. With this IFT scenario, I can do this before I even do my physical exam. I can pop this into the AI, and it can give me some things to jog my memory. If it's 2 o'clock in the morning or something like that.
To be honest with you, this is
Yeah.
not a bad answer actually. Like it's pretty good actually. Like,
No, it's really solid.
yeah, it's a solid answer actually.
Yeah,
Like, yeah. You want to go over it, that Joe?
yeah, let's do it. So, based on the information provided, the patient is a 70-year-old individual who fell and hit her head, resulting in an altered mental status and intubation due to the inability to protect her airway. So, again, we're just recapping. The patient has a history of using blood thinners and has been diagnosed with a subdural bleed and a midline shift of 1 centimeter on CT scan. Patient's current vitals have an elevated blood pressure and a heart rate of 106 and an SpO2 of 96% on vent mode and assist control. So the AI is basically just rewording it, just like if Mark gave me a report on this patient, I would reword it back to Mark to make sure that I understood it. It's the same thing the AI is doing in this first
It's,
paragraph.
it's called it's called
Um,
closed loop communication.
it's the most beautiful thing in medicine.
Yeah, correct.
All right. So, considering the patient's critical condition, the following steps should be taken on the ALS scope of practice. Like I said, this is jogging my memory before I ever even lay eyes on this patient. Step one: ensure the patient remains in event mode of assist control and maintain adequate oxygenation and ventilation. Continuous monitoring of the patient's hemodynamic status, including blood pressure, heart rate, and SpO2. Administering the appropriate medications to manage the patient's elevated pressure, if necessary, to prevent further bleeding and potential neurologic deterioration. Since the patient is on blood thinners, consult with medical control regarding the possibilities of administering fresh frozen plasma or prothrombin complex concentrate (PCC) to reverse the anticoagulant effects. Provide appropriate sedation and analgesia to ensure the patient is comfortable and minimize the risk of elevated intracranial pressure, and ensure that the patient is transported to City Hospital with continuous monitoring and appropriate care en route. As the patient is intubated and has a subdural bleed with midline shift, maintain a head of bed position, maintain the head of the patient. There we go. At 20 to 30 degrees, unless on contraindicated, and avoid fluid overload during transport. That's the thing that jog in your memory. I've seen so many people transport head bleeds laying flat.
Yeah.
Monitor the patient's neurologic status and consult medical control if there are any signs of neurologic deterioration. Please note this advice is based on the provided information and specific context of the query. The patient's care should be individualized based on the specific needs and the clinical judgment of the healthcare professional. So now we're going to give it a little bit more detail.
Okay.
Christian, why don't we just go ahead and pop the vent settings in and see what we get.
So give me those vent settings.
All right, so our mode is AC.
Let me talk to it, right? So why?
First world problems.
Yeah.
Yeah, for real.
I know.
You know what? Maybe it's going to come up with some good vent settings for us to start
I
with.
would just have to write it. I have to. I mean, it's a podcast or whatever. Like we have to improve this, right? Like so, I'm gonna have to be able to put text under. So that's basically the problem. So now I know that I'm just gonna write everything out basically in one line, basically.
Yeah.
Yeah.
All right.
But I just realized that why it is doing it now. That's good because now we need to fix that, right? But yeah, see, I mean, even the errors here in the podcast, you can see it. You know what I mean? Like, this is real. You know what I mean?
Yep.
Like, it's working. Yeah. There you go.
All right, so what do we got? We got considering the conversation history and the current query, the patient's ventilatory settings should be adjusted to provide lung protective strategies. I like that, as they are at risk of acute respiratory distress syndrome due to the critical condition and recent intubation. Set the tidal volume to 6 to 7 milliliters per kilogram of ideal body weight and adjust the FiO2 to maintain adequate partial pressure of oxygen. Since we didn't give it a weight, it's not going to give us a random calculation and say, we're not doing 412. We don't do that anymore. So having this tell us, you still have to calculate it. The choice of the ventilatory mode should be pressure support ventilations, which allows the setting the minimum parameters for breaths per minute and tidal volume and a minute volume. The mode helps to maintain constant positive airway pressure, similar to BiPAP, bi-level positive pressure ventilations, positive pressure, airway pressure, whatever. Positive end expiratory pressure PEEP should be applied to help open the alveoli clogged with mucus, vomitus, or infiltrates, and pneumonia patients, or edema in patients with congestive heart failure. However, larger tidal volumes at higher pressures increase the risk of pneumothorax. Close monitoring of patients during intubation and subsequent mechanical ventilations is essential because adequate sedation may prevent the patient from communicating symptoms of complications. Unexplained tachycardia, bradycardia, hypotension, and hypertension should be immediately investigated and addressed. Capnography and oxygen saturation monitoring, along with periodic arterial blood gas measurements, can guide the selection of ventilator settings, and FiO2 should be reduced as soon as possible while maintaining an adequate PO2. For this patient with a subdural bleed, sedation and analgesia should be provided carefully and transport to a specialized care center should be arranged for close monitoring, neurologic status, head position, and avoidance of fluid overload. Consult regarding potential anticoagulant reversal if applicable. So basically, what happened here, because we put part of a prompt in, is the AI gave us what it considered to be the safest method. Since we didn't have settings, it's not going to give us any settings. But when we put the settings in, we're going to back check them and see if they're the right settings for this patient.
All right.
Yeah,
So,
and it really,
what is the setting? I mean, these are really good answers. Actually, I'm pretty impressed. Actually, like,
yeah,
yeah, I'm
Yeah,
glad that it's
it's a
happening
really
now.
good. It is a really good one.
it's
It
fantastic.
went down the ARDS rabbit hole on the positive pressure ventilations, which is not a terrible thing, and I think
Yeah.
that its justification for it's great. So the settings are a PEEP of 5,
Uh huh.
an FiO2 of 40%,
Huh.
tidal volume of 450, and rate of 12.
Okay. You want to ask anything else?
Um, no, go ahead. Let's see what it does with this.
Okay. All right. It's fun to use it.
I love
Well,
using this thing, man. I sit around and play with it for hours.
yeah. I'm just like like normally like a place that doesn't know its thing like would be afraid of doing this live basically because it wouldn't be any good.
Yeah.
But for this thing, it's really good. So we're not afraid to go live. So yeah, yeah.
Pretty confident it's going to come up with, the most current best medical practices, and
Yeah.
it has. It's really good.
Yeah. All right, let's do it.
All right. So considering the conversation history, we're just gonna get another synopsis. PP5 FiO2 of 40 is within reasonable ranges for maintaining adequate oxygenation. The tidal volume of 450 and a rate of 12 may be adjusted based on the blood gases and clinical assessment. Again, you got to do your own work on these calculations. Given given the patient's history of using blood thinners and subdural bleed, midline shift, close monitoring of hemodynamic status and intracranial pressure is crucial. Elevated blood pressure should be managed carefully, considering the risk of further bleeding and need for adequate cerebral perfusion. Consultation for anticoagulant reversal should be considered if not already initiated. It keeps hitting on that huge safety point of if we're not anticoagulating, probably need to think about it. Sedation and analgesia should be
One second.
titrated to maintain.
We did tell you that it is good, right?
Oh yeah, oh yeah. I love it because it's so patient safety oriented.
Mhm.
Sedation and analgesia need to be titrated and to maintain patient comfort and to minimize the risk of elevated ICP. Transport to specialized care center for neurosurgical intervention should be arranged as soon as possible, ensuring close monitoring, appropriate management, and ventilation settings, and the hemodynamic status of the patient during transport. Based on the patient's age and the presence
Why
of a
don't we ask it to
subdural
calculate an
hematoma, the
ideal body weight?
possibility of yeah, let's do that. I've got um, give me a second to math this out because I have the weight. I don't have the actual height. Give me a second. It should be about 65 inches, I think.
Mhm.
So she should be about 65 inches tall.
Huh? Uh-huh.
And we do have to specify the sex of the patient because that is the IBW calculation. So
I think we already have in the conversation, and this thing should remember
I got
that
65 inch
it's a
tall, and
female.
what is the ideal body weight for this female, right? Is that correct?
Yes, sure.
All right.
Yeah.
All right.
So I did, on my end, open a new conversation
Mhm.
with the app, and I asked it, what is anasarca? ANASARCA. And it knew. It says, based on the information provided, anasarca is a term used to describe severe generalized edema or swelling throughout the body caused by various medical conditions.
Yeah, so that's one thing I've noticed is that if you're talking about
So
a
the
patient,
app definitely knows. Yeah. Yeah.
if you're talking about
Sometimes,
a patient and you have some kind of like a term question like that, sometimes it helps to open it in another window and just ask
yes.
it about the term.
Yeah. And that's part of
Um,
some of the best practices for this thing is if you want to talk about something that's different, or you just want an answer to a question, just open a second window next to what you're doing, with a fresh conversation.
yeah, and another thing that I found very helpful is because you have the tabs of your previous conversations on the side. If you do that, and then you for some reason you need to switch back to your original conversation, you can still open that up
Yeah.
later on.
Yep, you can open it back up and start talking again. All right, so it looks like it came up with
Um,
something here.
yeah, based on the information provided, I will calculate the ideal body weight for the female patient. IBW for this patient can be calculated using the following formula. IBW kilogram. Yeah, we all know the formula. Given the patient's height of 65 inches, we can substitute value into the formula, and it does the calculations. And down there at the bottom, looks like we came up with a weight of 50.05 kilograms, which is makes me feel a lot better about my own ability to calculate IBW because I did it backwards based on the weight I had to get to the height.
Yeah. Yep, exactly. And the one thing that this app is really strong about, um, in any conversation, but especially with calculations, is it shows you every step of its work, so you can look at it and you can verify before you make a decision on it.